role, sharing with you some of my personal perspectives that are influenced to some extent, though, by having been a policymaker and an appropriator of funds, which is why I kind of started out on the discussion about Texas's budget and the amount of money that we spend in health care and the rate of growth that we have in the Medicaid program primarily. Our president campaigned on the fact that we needed some health care reform. At this time, he's helping to promote a couple of bills coming out of this Congress, out of the House and out of the Senate, that are intended to try to bring insurance availability to a large number of people that are currently uninsured. And let me say this straight up front. I agree with the president that the number of people that we have uninsured is a problem. It's not because, I can't make a decent living at what I do. I certainly can, But there are tremendous disparities in the quality of health based solely on whether you have insurance or don't have insurance. And so I agree with the president that there needs to be a way that we respond to the problem that we have related to insurance. The problem I have today is the president says he thinks that this should be managed through a pro-competitive process. He happens to believe that a public option is a way to do that. You don't have to think back too far where the president said, I think a single-payer system run by the government is the answer to our problems. Now, I'm sometimes a little slow on the uptake, but I see those as two polar opposites. But what's not an opposite in terms of what his real intent is to create this single-payer, primarily government-operated system is the clear knowledge, and he's a smart guy, is that when you put a public option out there with the intent that it's going to compete against private health insurance, I'm going to put my money on the government every day. They're going to win that, and they're going to win that hands down. And so I don't support the president's perspective. It's not his bill yet. I don't support his perspective in terms of trying to deliver a solution to our health care problem by promoting a single-payer option out there, which I'm going to tell you we won't be there overnight. We won't be there in 2 years, 3 years, but we will be there by a decade if we decide that that's the place to go, or if our government decides that's the route that we want to go. And so I have serious problems with that. You say, well, why? There's a lot of very highly industrialized companies out there, countries out there that have a nationalized health care system. They have zero uninsured people out there. Zero. And I think there's probably some things that they probably do excel in with regard to the quality of health in those countries compared to the United States. I'll give you that to some extent. Although most of those numbers are fudged to try to basically make their point out there. But the problem I have with it is that, and you can't, there's no way you can argue this, is that if the government is going to run health care and bear the responsibility, the financial responsibility for it, the only way that you control the cost in that scenario is to ration the care. Now that's a little harsh term, and so maybe what it is that, well, you just can't get your care exactly when you want it. Well, okay, well, when can I get it? Well, I can get my health care for my knee in 23 months. I said, walking around with a cane right now. I'd sure like to have it done now. They say, well, no, I can't get it done now. So come to the United States, boom, you can get it like that, if you happen to have the money and are able to do that. You've heard some of the horror stories about people with cancer. The government said, we just can't do it right now. You don't fall in line in terms of having this cancer treated. What is it? You know that well, don't you? Yes. Spoke up at the Katy rally. I call it a rally. It was town hall, but it was a rally. And speak to the availability of the kind of therapies that we have available in this country pretty much at your will. And it does depend, though, to some extent on whether you have health insurance. And so I do think that having health insurance does have an impact on people's quality of life and the value of their life. So I promote that. I just don't agree with the President's public option as a vehicle to get there. I have concerns about the cooperative model that's being espoused in the Senate as a way to get there, especially if they're going to be funded by the government to get them going. I have real concerns about that. I like the idea of a cooperative for electricity, for agriculture, seems to work well. I'm just not clear that it's going to work in healthcare. I have real concerns if it gets funded by government dollars in order to do that, and that makes me very, very concerned about whether that's the right way for us to go. I can see them very quickly getting that quote-unquote public option out there.